Welcome to this short Zoom webinars what we are doing to get different aspects of aging related disorders and how we can manage many of those things at home. In today's session, we are going to talk about falls. We all know that falls are common in elderly people, and this is very much a preventable option. To talk about this, Dr. Rosie Newpine will be speaking about that. She is a master's in physiotherapy, neurological and psychosomatic disorders, and she has been working on Parkinsonian disorders and various movement disorders patients for last 1 year. I welcome Rosie, and she'll be speaking primarily in English. If anything questions are there, we'll be trying to address all the questions in whichever language people are comfortable with. We'll try to limit the session to whole session for about 25 to 30 minutes so that it doesn't appear also too prolonged for anyone else to see later on. Thank you. Thanks a lot, Rosie. You can take over the session from here.
Thank you, Dr. Prashant. Thank you so much. Good morning, everyone, and welcome to our discussion. I'm Dr. Rosie, currently working in Parkinson disease and movement disorder clinic located in Bangalore. So today we have designed our discussion to increase awareness about fall and fall prevention. So heading to our session now. So let us start with the discussion why fall is very important to us. So fall is very important because it's very common and it comes with a very expensive package. Millions of people fall each year. So fall is a marker for your declining health condition, and as we know, significant numbers of falls are preventable. So the marker for decline can be reversed if we start our fall prevention program as early as possible. So injury after fall could mean to end up living on your own, and you will be dependent on other family members and your caretaker and nurse. So once you develop the fall, you develop fear of falling again. So you start restricting your activities, you start limiting your movement. So according to current statistic, approximately 1/3 over 65 years old and half over 80 years develop fall each year, in which 9% develops fear of fall, restricting their daily activities. So one out of 5 patients after fall develops serious injuries. Okay, so let's discuss who are more prone to fall and what all are the risk factors for the fall. So first comes previous history of fall. As I said earlier, once you have a fall, you start restricting your daily activities, which can lead to immobilization. With immobilization, you won't be doing any movement, which decrease your muscle strength, range of motion of each joint. You won't be able to move your joint to its full range. Also leading to imbalance in coordination, which is also a further risk factor for a fall. So next, fall is very common in old age. With advancing age, we develop various kind of changes. We develop changes in our muscle mass. We develop changes with our bone density, which can lead to decrease in muscle strength, immobility, imbalance, incoordination, leading to the risk of fall. So next comes your sedentary lifestyle, poor mobility, vision, cognition, and also your hearing. So if you are your vision and hearing is not proper, you won't be able to see the obstacle which is on your way, which can further lead to fall. So underlying neurological condition, cardiovascular, musculoskeletal condition like Parkinson, progressive supranuclear palsy, osteoarthritis, Huntington's disease, stroke, cerebral palsy, even your UTIs and incontinence can lead to fall. So there are various consequences and effects of fall. So first comes the psychological part. Once you fall, you lose the confidence, you lose the motivation to move around, you lose the motivation to do your own activities, you start isolating yourself, you stop socializing with people, you can develop fear of further falling, which can lead to the negative circle of fall. So this is the negative circle of fall. Already the risk factor is there. You develop a fall once, you lose the confidence, you reduce your activities, socialization, walking around, which can further lead to a loss of confidence, depression, which itself is another risk factor of fall. So what happens, already you have the risk factor for fall, so you start developing other various risk factor for fall. So next comes functional. So once you develop fall, you lose the confidence to walk around. You lose your you lose your independence, and you start depending on your caretaker, family member for each and every activity, which also comes with social care cost, including your hospitalization cost. So also physically you can develop fracture, pain, bruising, head injury, and other various related injury. So out of all the fall, over 80 over the people with age group over 80 years, 90% of them develop hip fracture, limiting their daily activities. So let us discuss how we can prevent the fall. So first comes tailored exercise program. So if you are exercising daily, you are going to your physical therapy, or you are going for a walk, you are going for a group therapies, it can reduce the chance of fall by more than 50%. And Tai Chi itself, Tai Chi is a kind of a exercise where you involve each and every joint. You involve all the rotation movement, lifting movement. It's a slow dancing kind of movement. This itself can reduce the fall by more than 30%. So next comes check for a home hazards and modify them accordingly, which we'll be discussing further. Next, get enough vitamin D and eat a diet rich in calcium, because vitamin D and calcium are both very important for your bone health. Ask about your medication, review your medication with your physician. So what happens, many people once they go for a review, they start using the medication, they don't feel like going for a follow up, they start using the outdated medication which might not be working for the current condition of the patient. So always better review your medication if there is any change to the prescribed drugs, or because there are many medication which can lead to imbalance also, such as your sedatives. Next, look after your feet. So uh, wear proper fitted shoes, anti-slip on footwears while walking around. Avoid using flip flops. Also check for any foot ulcer, gangrene. Clean them. Take good care of them. And also the next point is check your hearing and vision regularly. So let us discuss about the fall hazards, which we can see most commonly in our surrounding areas. First, staircase without handrails. Falls in the staircase is very common, and it can happen anywhere, everywhere, and to everyone. Next is loose extension cords lying on the floor, where you can just trip and fall inside your home also. Outdated medication, as I explained earlier, review your medication on time. Loose rugs lying on the floor, flip-flop footwear, no handle on the door, heavy doors where you cannot push the door, clothes lying on the floor. So if you have already fallen before, identifying first fall and uh, recording the first fall, documenting the first fall is very important, because not all the falls can be prevented. And according to the recent research, those who have fallen before will again fall after within 12 months. So identifying first fall and working towards its intervention is very important. So if you are under various medication, it might lead to recurrent fall. So according to World Health Organization and Institute of Care and Excellence, individuals with 4 or more medication are considered risk for recurrent fall. So this is the picture. You can see various hazards in this picture. So whatever hazard you can see, you can just put in our chat box so everyone can see it. Are you all Bhavani Priya, extension cord? Yes, correct. No railing. Yes, very important. Box on the stairs. Loose carpet, loose rocks. Yes. Wire triangle on the floor. Very good. Also, you can see the smoke alarm is damaged. Next, cigarettes are burning cigarettes lying on the floor. Open cupboard where medicine are not arranged. Cabinet door open. Yes, you can just keep now chat box. Okay, moving towards our next one. What are the safety tips and home modification you can do it? First, bathroom safety. Bathroom fall is most common in old age people. First and foremost, you can just install a grab bar. It should be present at both toilet and shower. Even if you have not fallen it, you should install this for further prevention. Elevated toilet seat if you are not able to sit or stand properly. Use shower chair if you feel you need. Install non-skid strip mat in bathtubs, shower, or on the floor. And all your toiletries should be placed where it's easy for you to reach. Next, stairs. As I said earlier, fall on the stairs can happen very easily, anytime, anywhere, and to everyone. So, installing handrails on each side if possible, if not on the one side itself. Edge of the steps should be easily visible. If you are suffering from the unilateral pain or unilateral weakness, always go up the step with the stronger leg. Suppose I have pain in my right hip, I'll go up the stairs with using my left leg, and while coming down, always use the less stronger leg. That means if I am having problem with my right leg, while coming down the stairs, I'll use my right leg first, followed by the left. So more additional tips, what you can do is you can organize the medication in 7-day supply container so that you won't go out of the medication when it's necessary. So suppose you are a Parkinson patient and you are taking levodopa as your daily medication. So if you are in an off state, you are more prone to fall. So to prevent that, store and organize medication in a container so that you will come to know when the medication is getting over. Your phones will be easily accessible. Use proper assistive device. If you feel like you can fall anywhere, you don't know about your direction, you can either fall forward, backward, left, right. Better to go for a walker. If you have a unilateral weakness, you feel your fall is only towards one side. Suppose you feel you are getting you feel like you are falling to the right side, better use cane in opposite hand of the injury or weakness. Suppose if I'm having right side weakness, I prefer using cane on the left side. Wear good shoes and be careful of a slip on. Speak up, talk to your doctors about any fall or fall risk you are experiencing. Get your vision and hearing checked regularly. Be active, move around. If you are still working in the kitchen and all, keep items where it's easily reachable for you. Clean up the spills immediately. In bedroom, your switch will be easily reachable to you. uh, have a place in between where you can comfortably sit to get dressed and undressed, and your ideal bed height should be in the level of the knee. It should not be too high or not too low. So moving towards our most important part for today, why exercise? So most of the people don't want to do exercise because of the fear of fall. So but exercise itself can help you with fear of falling and your fall self efficacy. It can also address your weak leg uh, or any pain and all, so that if you feel like you have a strong weaker leg, go for a strength training. If you feel you are getting imbalance, go for a balance training. If you feel your coordination is not proper, you can go for a coordination training. So also addressing gait and balance problem, your walking and balance problem can improve your motor and cognition. Various goal-based therapies are available. Aerobic exercise also can successfully improve your both motor and cognitive aspect. So next point, also exercise helps to delay your disease progression, delaying the motor decay, also delaying the need for your increasing medication requirement. So we'll go to the exercise session now. First, very easy to do, and you can do wherever you want. Uh, this is sit to stand. Sit to stand exercise not only improve your ability to do everyday work, balance and mobility, it also helps to build up the strength in your core and leg muscles. So you start by sitting in the chair first with feet uh, apart in your shoulder level. So keep your hand in front of the chest as shown in the slide. So before starting, make sure your chair is a stable and it's not a Wheelchair. So without using your hand, first push up through your feet to stand, and if possible, hold this position for few seconds. And to sit, bend your knee slowly to sit in the chair with control. So if you are not able to do this task with a normal chair, you can make it easier with adding a cushion into your chair to raise the height, or you can simply use the taller chair. And if you are able to do this and you are ready to progress to the next step, you can make it slightly harder by using the chair with a lower height, or simply sitting down more slowly. If you are sitting down more slowly, you need more muscular control, which can build up more strength. Okay. Next, once you are able to stand with your feet apart, you can slowly move your feet together as shown in the slide. After that, you can try standing on one foot while bending your knee towards your chest. And if you want to further progress from this step, you can close your eyes and check for your balance. Okay. Next is heel lift. Start in a standing position. If you feel you need support, take support from the chair or hold the grab bars. If you feel you are confident enough, just place your hand on the hip and slowly rise your hip, stand on your tiptoes, and at least hold for 5 to 10 seconds. Single knee lift, you can just simply bend your knee towards your chest and hold for few seconds. Alternate marching or marching in place. You can either do this in the sitting position if you are not able to stand, and standing position. So just march with alternate step in slow to moderate pace. Leg extension, it is very important to build the strength on your quadricep muscle. Uh, this muscle is holding you upright while standing. So sit on the chair with back support and slowly straight your leg and hold for few seconds. And you can keep the leg back and start with another leg. So walking is also a very good exercise. Walking is needed for your daily activity to move around. If you feel like you are not able to walk without an assistive device, choose the assistive device for your support. You can also try walking with a narrow step, heel to toe walking. You can walk in the uneven ground, stand, soft surface, hard surface. Also, you can go for an aerobic like swimming, cycling. And Tai Chi has been proven to be a very good exercise to prevent fall. How to sustain the fall prevention program? Uh, First, go for a regular training session. Include all your family member, caretaker. Education is very important. Next, once you started the fall prevention session, you go for a regular follow up with both your mobility, medicines, health condition, overall health. So tailor intervention, customized program can also help to prevent fall. So suppose I have a unilateral weakness, I'll go for a strength training on my unilateral side. So multidisciplinary approach. So involve all your family member, residents, caretaker, health professionals, your physician, and all other relevant field. So environmental modification, as we discussed earlier. Next comes the feedback mechanism. Use feedback from others to make the continuous improvement and address your current concern. Documenting your fall. So documenting and communicating about your fall. So for this, you can maintain a fall diary. You can record your fall frequency, surrounding circumstances where you have fallen, date, time, a location where you had the fall, level of injury if you have experienced any. So here we come to end of our session. Any question you can ask now.
Thank you, Rosie. Very nice, very concise way of telling what are the risks associated with falls and how to manage falls. What are the simple activities or exercises what we can try to do at home by ourselves so that we can do better. Thank you. Thanks once again. Thanks everyone for joining the session. Thank you.